Morning, everyone. Hope everybody had a good weekend. We'll get started in just a second. I'm going to give it some more time for people to hop on, and I'm also going to pull up my slides here. We'll get started. How's everybody doing today? Oh, if you guys can hear me okay, go ahead and put in the comments whether you can or not. That would be awesome. We had some audio issues for a workshop last week. I just want to make sure everybody can hear me. And then I'm always interested to see too, because I know this group got a lot of different people all across the U.S. If you guys could put in where you're tuning in from, that would be awesome. I think we got a few people here from California to New York, to the Midwest. If you guys could put where you're tuning from, that would be awesome too. Awesome, thanks, Alex. Glad you guys can hear me. Good. How was your weekend, Alex? Hopefully you're able to stay safe with all the craziness going on over the weekend here. One more minute. If you guys have any questions right off the bat you want answered, or burning questions, just go ahead and throw those in the comments. That's another thing too, is throughout the workshop, if you guys have questions that come up, just throw them in the comments, and I can see those come in as they do, and I'll address them. Or if something's not making sense, just let me know. It's most likely because I didn't do a good job of explaining, not that you're not able to understand it. All right, guys, we'll go ahead and get started. So if you are here to learn how to run pain-free, or you want to improve your performance and want to just simply prevent running injuries from occurring, you are in the right spot. That's what we're going to be talking about today. I want to make sure that you guys get all your questions answered as well. I think pretty much everybody in the group knows me, but for those that don't, I'm Dr. Ben with Pro+Kinetix Physical Therapy and Performance. We're located in Uptown Oakland, and we specialize in helping active adults and athletes get back to workouts, running, sports that they enjoy without medications, injections, or surgery. So yeah, I think that covers that. And then main thing is I want you guys to also, just so I know who I'm talking to as well, because I can tell I've got my kind of general notes and slides and whatnot, but what I'm going to plan on following, but I can also tailor this a little bit to who's tuning in as well. So if you guys are having any specific pain, let me know where that's at, whether that's ankles, knees, hips, or low back. That would be great. And then if you guys could tell me like what you're having difficulty doing because of the pain, that would be awesome too. It kind of helps me formulate who I'm talking to. You know, if I have a bunch of people in here that are tuning in, it's all knee pain, I'm going to structure this workshop towards more knee pain related injuries with running, or if it's kind of all over the place, then I'll kind of do more general. But yeah, if you guys could do that, that would be awesome. And then the main thing too is I want you guys to know that a lot of people, when they have injuries with running, they just think that it's just something they have to deal with, and it just comes with the territory. Shouldn't be that way, all right? And there is a solution. There's no reason you need to keep running with knee pain or anything like that. All right, guys? All right. So objectives for today is we want to go over kind of the more common causes of running injuries and different diagnoses that can be going on, and then also effective treatment for running injuries, and then strategies for prevention. Like I mentioned earlier, most importantly, answer any questions that you guys have as well. All right. So running injuries, super common. Up to 70% of recreational and competitive runners sustain overuse injuries during any 12-month period. All right. 42% of running injuries are in the knee, followed by 17% in the foot or ankle, and then 13 to the lower leg, and 11 in the hip or the pelvis area. right? So you guys can see that we have quite a bit of different diversity with regards to where these injuries can occur throughout the body, okay, with running. It's all kind of all over the place. But yeah, I mean, those numbers are consistent with what we see in the clinic as well. By far, it's most running injuries are to the knee, but yeah, they can happen anywhere throughout the body too. All right, and you guys are probably wondering, like, well, why is running injuries so prevalent? Right? Why do so many people deal with these running injuries? It's because when we're running, we're landing with 3 to 5 times your body weight, right? With every step. And if you can imagine if you're doing 5 miles, 3 to 5 miles every single day, over the course of time, it doesn't take long before each step and landing with 3 to 5 times your body weight starts adding up. You can kind of take its toll on the body. And not a knock against runners, but a lot of times runners are just super passionate. They just want to run. And what they forget to do is strength training, right? And when if we're landing with 3 to 5 times our body weight, we need to have that necessary strength and muscular endurance as well to be able to sustain our body's capacity to land with that weight and be able to still function properly. Okay? So strength training is super important, and I think that's one main thing that we see a lot when somebody comes and sees us for running injuries. A lot of times they're not doing a strength training program. Right? So predictors of injury. Is there ways or a formula that we can kind of use to predict when injuries are going to occur, if they're going to occur? So history of injury. All right, if you've had a history of injury in the past, history of injury puts us at a significant increased risk already for having another injury. Right? Weekly mileage, and then also pattern of increase. So if you're increasing, if you haven't ran in the past and you ramp up and start deciding you're gonna run 2 or 3 miles every single day, just from there on out, it's not gonna be pretty. Right? You need to be slowly integrating and getting your body used to running again. Okay, so you need to ramp up appropriately, and then also like the way our body moves when we're running, and our running mechanics can also tell us a little bit too. That's one thing that we do as well as running analysis. Do a video running analysis and see what's happening with the knee as you land. Are you landing Are you landing on your forefoot? Are you doing a heel strike? Is that knee collapsing in? What's going on at the low back? Are the hips providing that stability? Okay? So video analysis and running analysis can tell us a little bit too about somebody's risk for injury. Right? And then impact forces. Like I mentioned earlier, we're landing with 3 to 5 times our body weight. How are we landing? Are we landing with our heel first? Or are we landing with our forefoot? And I'll get into that in just a second and why that's important. And then body mass index. Right? So if we are carrying around extra weight, okay, that's extra weight that we're landing. Okay, for example, if we just carry 1 pound, if we gain 1 pound of fat mass, you times that by 3 to 5. Now we're landing with 3 to 5 times, or 3 to 5 extra pounds with every step, just by gaining 1 pound. Right? So body mass index and carrying extra weight is also a predictor of injury as well. Okay, so those are the general ones. All right, any questions on that, guys? Before we kind of get into the anatomy. All right, we're not going to go super in depth with anatomy, but I want you guys to have a decent idea of the anatomy. Because if you guys understand the anatomy and everything that I talk about down the road in this workshop is going to make much more sense to you guys. Okay, and it's just important. I think everybody should understand, what's going on with the body, how it works, and to a general sense. I don't expect you guys to be, medical doctors or physical therapists or chiropractor or anything like that by the end of today's workshop, but I think it's important for you guys to have that background knowledge. All right. So some brief anatomy. We have our kneecap. Okay. Let me pull up. Make sure you guys can see what I'm demonstrating here. All right. So we have our kneecap. Okay. Right here. And then from there, right above that kneecap, we have our quad. Okay. That quad muscle extends up into the top of the hip, all the way down to the knee. All right. And then on top of that, we have this kneecap doesn't just like stay where it's at. You guys can see my kneecaps here. Watch what happens as I bend my knee. You guys see how that kneecap drops down into the groove? Okay? That kneecap has to have the mobility. And on top of that, there's kind of like a track system. or grooves that that kneecap has to travel with it. If it doesn't track properly, then we can start getting some pain. So if you guys straighten out your leg, you guys can see your kneecap moves, okay? It should. It needs to be able to move freely, okay? If we get too tight of muscles of the IT band or the quad, because they attach, that IT band comes down and attaches at the side of the kneecap, that quad comes down and attaches at the top of the kneecap. If certain structures of the quad and the IT band are tight, it could start pulling that kneecap. So like my IT band's tight, it's gonna pull the kneecap over the side, right? And now we're gonna start riding kind of on that track or that groove. We can get some irritation underneath that kneecap. On top of that, if we have a tight quad, all right, we talked about how that kneecap has to drop down into the groove. If that quad's super tight, guess what's gonna happen? That kneecap's gonna sit right up here. It's not gonna drop down into that groove, okay? And even if it does drop into that groove, now you got all those tensile forces of that quad, okay? That's increasing that compression underneath. It's kind of like a pulley, okay? It's gonna increase that compression, increase the rubbing underneath, okay? And that leads to patellofemoral syndrome, and we're gonna talk about what that is in just a second as well. Other anatomy, femur, okay, big thigh bone, and then we have our shin, our tibia, and our fibula, okay? There's a little bit more ligaments and whatnot as well, but we're not going to get into, you guys don't need to know all that, all right? Don't want to overwhelm you guys. All right. Oh, one of the things we have a meniscus. Our meniscus is, so we have our femur and then our shin bone, okay, and we have our meniscus. That's over the top, and meniscus over the femur. And this is just kind of like connective tissue. It's kind of like it's like padding. Okay, and this can get irritated or torn. Like if we're gonna, like a lot of football players tear the meniscus because of cutting. It's usually with rotation movements. All right, that's how we usually tear a meniscus. So if I'm running and I plant and then I go to turn, okay, I'm getting a lot of rotation of the femur, this bone, on top of this tibia where I'm rotating. Okay, and when we rotate, it can irritate that meniscus and cause a tear. All right, that's the most common cause of it. All right, I mean, it's not just for football players. We see this, every day. Like you can get it with running, but most likely it's usually with rotation component there. Okay. All right. Hopefully that all makes sense. I didn't overwhelm you guys. All right. So we're going to move on to the most common types of running injuries. All right. So let's go back and touch on that patellofemoral pain. All right, because that's probably the most common knee injury that we see with runners, is that poor tracking of that kneecap. And that can be due to the IT band, it can be due to tight quads, okay? But you got to also figure out, you guys are probably wondering, well, why am I prone to having a tight IT band or a tight quad? And it could be due to the way that you run. Can be muscle imbalances. Okay, if we have a weak glute or weaker muscles throughout the body, in the lower body, then this quad and this IT band are going to be overactive and overutilized, and they get tight and get irritated. Okay, so I see a lot of people that just foam roll the crap out of their quads and their IT band and stretch, and there's it helps, but only temporarily. Okay, that's because they're treating the symptoms. They're not treating the root cause. The root cause is weakness. All right, they're treating the symptoms by doing the stretching, okay? All right, and then we have patellar tendonitis. Okay, so patellar tendonitis, we have the kneecap, okay, and then below the kneecap, you guys feel your kneecap right at the bottom, and then there's another kind of bone about an inch down, okay? That's where that patellar tendon spans. Okay, so that's about about 2 inches long. And that just connects the kneecap down to the lower leg. And that can become irritated too if it's mainly through overuse. Okay? Our patellar tendon just becomes overused and irritated, and we get inflammation and pain in that area. And that again can be due to what's going on with the quad. If the quad's really tight, again, that quad goes down and attaches to the top of the kneecap. Right? So it's going to influence that kneecap, which that kneecap, the patellar tendon inserts into. All right, so there's some overlap there. Okay, and then another thing is runner's knee. All right, so this is pain on the outside of the knee, kind of right on the edge of the kneecap. Okay, on the side or out laterally, And that, again, we talked about how that IT band comes down and attaches at the side of that knee, right? So a lot of times with runner's knee or IT band syndrome, we have pain on the side of the knee, and then also up to kind of up on towards halfway through up to the hip, between the knee and here. We kind of get pain right through here, and then it comes down and attaches, and we can get some pain down here as well. And a lot of times when we have IT band syndrome or runner's knee, we also have subsequent patellofemoral issues, because a lot of times the IT band syndrome or runner's knee is caused by tight IT band. Okay, when tight IT band occurs, then we have that poor tracking of that kneecap, because that IT band is tight and pulling that kneecap off to the side. All right, and then shin splints is huge. Okay, we see this a lot. I actually had a runner that came into me and saw me, I think it was probably in January or February, and she had a marathon that she wanted to run in February, and this was like it was like 2 or 3 weeks before her marathon, and she was having terrible shin splints. All right, and so it's not very easy to progress somebody that's having terrible shin splints into getting them back to running a marathon. But really the only thing that gave us a really shot, so you can do it for shin splints, you can roll out the calves, you can roll out the kind of the front of the shins, you can do different stretches and stuff, and that can kind of take care of it. But that's a longer recovery. But she wanted to have the best chance of getting to do this marathon as fast as possible. So we took a kind of an untraditional approach, and we started looking at her running mechanics super early. Like on her first visit, we started changing up her running form. And usually when you change up somebody's running form, you should take it pretty gradually. You shouldn't kind of go 0 to 100 with it. But we kind of went from like switching her running form like to a 80 to a 20% change. Okay, meaning I'll kind of give you some background. We looked at her running mechanics, and when she was landing with on her heel. Okay, she's doing a heel strike running. I asked her, I'm like, do you know if you're running how you run? Do you know if you do a heel strike or a forefoot? She's like, I'm not sure. Okay, when somebody says they're not sure how they run, 9 times out of 10, they're actually doing a heel strike. They're not running on their toes or on their forefoot. Okay, I encourage all runners to land on their forefoot. Okay, the reason for that is when we do a heel strike and we land with our heel first, that heel is bone. Right? There's no shock absorption that's occurring there. Okay, so shock goes up from the heel. Guess what's next? That shin. Okay, again, that shin is bone. We're not getting any shock absorption or cushion from that at all. All that stress gets put in from the heel into the shin, and then next thing is the knee joint. Okay, so a lot of times people that run with a heel strike, or all that stress is getting placed to that knee, we get knee pain as well. Okay. So by switching to running more on our forefoot, now guess what? Just based on the biomechanics and how the lower body works and the ankle and the knee, now by running more on my forefoot, again, I'm not saying you have to run on your toes. I don't want you to tiptoe running. Okay? What you should be doing is you should be landing with like about 1/2 inch to 1 inch gap between the floor or the ground and your heel. Okay? So what that does is by landing on our forefoot, now we get help from the calf muscles. Okay, so instead of loading and asking the heel and the shin to provide that shock absorption, now we've got muscles to help out with that. Okay, muscles are much more resilient. They're going to also provide a lot more cushioning than bone can. Okay, however, you have to be careful with this because you don't want to get Achilles tendonitis or calf strain or anything like that. And that's what we had to be careful with. I asked her, I'm like, how important is running this marathon to you? And she's like, super important, been training for months on this. And I'm like, okay, well, we can ramp up a little bit more quickly than we traditionally would, but we run the risk of developing some Achilles tendonitis and irritation there. There's some exercise you can do to prevent it. So I had her doing that simultaneously, but we ramped up super fast. And anyway, she was able to run the marathon without any shin pain or Achilles tendonitis or irritation there in like 3 weeks. It was crazy. But yeah, so shin splints a lot of times can be just fixed by changing the running form if you're doing the heel strike. Okay, switching that forefoot's important. But again, you don't want to be just switching from heel strike to forefoot really quick. Okay? You want to be building up your tolerance for that. Okay. So yeah, those are the main common types of injuries that we see, and the most common running injuries in general. Any questions on that, guys, at all? All right, so let's get into some testing so you guys can see, are you at increased risk? And if so, where are these deficits popping up at? Okay, so we're gonna go through a couple tests that we use as physical therapists to determine what's going on. Again, these are not like all the tests that we do, but they'll give you guys some insight, some simpler ones that you guys can utilize without any background or training or anything like that, and start giving you guys some insight onto what's going on. Okay, so one thing that I want you guys to do is let's go ahead and look at your guys' knee control. Okay, so one thing that we see a lot is running injuries because people cannot control what their knee is doing and their knee space. Okay, what I mean by that is we start seeing if we have weaker hips. Okay, one of our hip muscles called the glute medius is responsible for kicking the leg out like this, or if we are squatting, okay, it restricts the knees from collapsing. So if you guys see somebody that squats like this, or if you squat like this yourself, okay, you guys see how my knees collapsing in? The knee should be out here, okay? If you see somebody squatting like this, it's because they most likely have poor control or poor activation of their glutes, or they have a weak glute, okay? Vice versa, if we're landing and we're running, you guys know darn well if your knees are collapsing in here, when you've got both your legs helping provide support, you know darn well it's going to be collapsing in too when you're running, okay? Because you're always in a single leg stance, okay? You're never on two legs at once, okay? So a lot of times we see when somebody runs, you start seeing this knee collapsing very subtly, okay, like this. You guys can imagine how much stress it's going to place on the knee and how it's going to change things up as well. So one thing you guys can do, determine, is this happening when you're running? Is actually doing a single leg squat. Okay, let me pull up the camera here so I can make sure you guys can see everything, okay? All right, so I want you guys to watch my knee. All right, I'm gonna show you what you don't want to be doing, and then I'm gonna show you what it should and should not look like, okay? So, I want you to do is you're gonna stand on one leg, okay, like this. What you're gonna do is you're going to squat down, okay, like this, into the chair, okay? I want you guys to watch my knee, okay, as I go down. You guys see how my knee's staying out, okay, all the way down. You guys can see like it's collapsing. If this would be a failed test, okay? If I have somebody come in, I tell them to do a single leg squat, and it's like that, okay, where it's collapsing in, or I see a lot of shaking and wiggling, okay, that tells me that that glute doesn't have the control that it needs to. Okay, and so most likely if you're doing that during a single leg squat, it's also happening when you're running as well, okay? So I want you guys to give that a try. All right, if you have pain with that, that definitely tells me that that glute's weak, and that might be actually what's causing some of that knee pain, because you have poor knee control, okay? All right, any questions on that? So we're gonna move on to ankle range of motion, okay, and why that's important. So when we run, we have to have adequate ankle range of motion. If we don't have that's going to start changing the biomechanics of what's happening above the joint and the knee joint as well as the hip. Okay, so I'm gonna turn this around so you guys can see. All right, so what you're going to do is you're going to come up to a wall. Okay, and what you're going to do is you're going to take your foot and you're bringing it up to that wall. Okay, and what you're going to do is you're going to try and take that knee and touch your knee to that wall. Okay, it doesn't matter what this back leg's doing. Okay, this will be providing some support, taking that knee, driving it to the wall. You guys should be all okay with that. All right. Now what we're going to do is you're going to bring that back an inch and do the exact same thing. Okay, and you're going to go inch by inch back until you start seeing that heel come up. That heel should not be elevated. Once you start feeling that heel come up, that's your limitation. Okay, that's your limit. That's where you're going to max out. Okay. So my max is about 4 inches there. Okay? Go ahead and give that a try on both sides. So the norms for that, okay, We should be, for normal walking pattern, the research shows we need 3 inches away from that wall. Okay, if we don't have that 3 inches away from that wall before our heel lifts up, we're gonna start seeing some changes in our walking pattern, okay, which can lead to issues up the chain in the knee, hip, low back. For running, we need even more, or for people that are doing like deep squats, we need ideally 4 to 5 inches away from that wall. Okay, that's just because based on with regards to running and deep squats, our shin is moving a little bit more. Okay, it needs a little bit increased range of motion at the ankle to be able to do that. If we don't have that, it can lead to a lot of cascade of issues up the chain. Okay, so yeah, that's going to be give you a good insight on if the ankle is playing a factor into things. All right, make sure you guys do that on both sides. I am going to grab a box here for this next test. All right, I'll be right back. You guys continue to do that. And then also make sure to monitor if you're having any imbalances between the left and the right. Okay? Because we're better off having 2 equally bad ankles than one that's good and one that's bad. Grab this box here. So you guys can use like the edge of your bed for this test. Okay. So what you're gonna do is you're gonna sit at the very, very edge of your bed. What you're gonna do is you're gonna take your right knee and you're bringing it up to your chest and you're gonna fall back. Okay. This test is utilized to determine if you have tight quads, tight hip flexor, or tight IT band. All right. So that quad comes from here and attaches to the knee. It's responsible for kicking the leg out. If our quad is tight, even when we're relaxed, this leg's going to kick out. Okay, so you guys can see, you kind of hold my leg out right here. This would be a positive test for quad tightness. Our legs should be hanging at 90 degrees here, relaxed. Okay, if you relax and your leg goes out here, that means you have a tight quad. Okay, should be right here, okay, 90 degrees. But first, if we have a tight hip flexor, our legs can be elevated. You guys might feel like there's a gap, maybe very subtly, maybe between the bottom of your leg and the table. Right? That's again, because hip flexor attachment from here to here. If it's tight, it's going to lift the leg. Okay? If you guys do that on both sides, we can also tell if the IT band is tight by laying on the back like this. Okay, same thing. If I start seeing my hip leg drift out like this, we should be in line with here. Everything should be in line. If we have a tight IT band, it attaches from side here to here. It's going to pull that leg out. Okay, so this would be a positive test for IT band tightness. It should be here. Okay, so this is a very valuable test. It can tell us if there's IT band, quad, or hip flexor tightness, and what's going on with that. Okay, so those are 3 tests that can give you guys some insight on, is it quad tightness, is it hip flexor tightness, or is it poor knee control? Okay, was in there some hip weakness? Okay, hopefully all that makes sense, guys. All right, so before we get into some of the treatment, any questions on that at all? We're about to go over the exercises too. I just want to go over some general treatment guidelines for you guys. So first part of treatment is you need to figure out and understand what's causing this. Is it running? Is it the way is it because you're sitting too much? Is it the way your work ergonomics are set up? Is it the way that you're doing squats? Is it the way that you're working out? Is it different exercises that you're doing that are irritating it? Because you can do all the treatment you want, but if you don't treat the underlying issue of what's causing it, it's an uphill battle. It can take much longer to recover, okay? And so a lot of times I hear people come in and they're like, I have them do an exercise, like, yeah, I've tried that exercise in the past. I'm like, okay, but what did you fix because we found out that their work ergonomics is what was causing some of their quad tightness, right? So they were doing all this treatment, and it was making it somewhat better, but it wasn't really resolving the whole thing. And that was because they didn't treat they didn't modify what was the underlying cause of it. Okay. Then we need to restore range of motion. Okay, we need to loosen up whatever muscles are tight, whether that's the IT band, quad, calves, or whatever the mobility restriction is. And then we also need to strengthen up. Okay, and this is a portion that a lot of people mess up on. They do all this foam rolling, all this stretching, which is great, but it's really just treating the symptoms. You need to get to the root cause and figure out what are the imbalances of your specific injury and your just your imbalances throughout your body as well. Okay. So then we also need to consider weight loss if that's appropriate. Okay, again, we talked about body mass index is also a high predictor of running injuries. And then also activity modification. We don't want to just get stuck doing the same thing over and over again. We don't want to just keep running. We need to be doing some strength training and bulletproofing the body that way as well. Okay. And then if all else fails, if you guys have been dealing with this for over 3 to 4 weeks, you need to find a medical professional that can help you, whether it's us, a physical therapist, chiropractor, physician. You need to be able to find somebody that can kind of guide you as well. Okay. Because one thing, this kind of analogy that I've heard another physical therapist use, and I kind of liked it, is like, imagine you put yourself in a room, okay, and it's a circular room, and you've got doors all the way around lining it, okay? All the doors are closed except one, okay? And that door is actually, the open door is the one that gives you that pain relief, okay? So imagine you're in a room, got a blindfold on, okay? They spin you around, you don't know which direction's which, you don't know which door is open, and so kind of trying to figure it out on your own is like just randomly trying different exercises and going in one direction, hoping you're going towards the open door. And you run into the closed door, it hurts, you start all over again, keep going. If you find somebody that can help you, okay, a medical professional that can help you, you get a straight line shot to that open door without all the headaches of and the pain of trying to figure it out on your own. And sometimes people don't even find that door or that door being pain relief as well. Okay. All right. So let's get into some treatment. All right. So we're going to go over on how a lot of times knee pain is caused by tight quads. Okay. We talked about how one of the most common injuries we see is that patellofemoral syndrome or improper tracking. And that's due to the tight quads. Okay. So let's go over the next step for that. So if you guys have a mat, go ahead and grab a mat. And then if you have a foam roller, grab a foam roller. Okay, I'm going to grab mine here. We're also going to go over, a lot of people have been sitting more and a little bit less active because of the lockdowns and whatnot. So that hip flexor tends to get tight as well. So what you guys are going to do, if you are having knee pain, sometimes kneeling down on the knee can cause pain. What you can do is just roll up the yoga mat or the mat that you have, or putting like a pillow underneath. Right? What you're going to do is you're going to get a half kneeling position, okay, like this. All right. What you're going to do is we're going to be trying to stretch this hip flexor out. We're going to squeeze this right glute, pull our rib cage down, and then we're shifting our hips forward. Okay, we should feel a pretty good stretch right in front of the hip. Yeah, ideally we're holding stretches for about 30 seconds. Okay. For time purposes, we're not going to go through, we should also be doing like 3 sets of 30 seconds. For time purposes, we're not going to go through all that. Just going to go through one set. And you should be feeling a nice stretch in the front of the hip. And make sure you're squeezing that right glute, pulling that rib cage down, and then shifting forward. I see a lot of people that don't squeeze their glute and don't contract their core, and they're like lunging like this, like, I don't feel a stretch. And it's because they're not, by squeezing that glute and pulling that rib cage down, it kind of locks that pelvis in place and holds that hip flexor in place, and we can get a more intense stretch without having to lunge so far forward. Make sure you're squeezing that glute and pulling the rib cage down, and then you can do the same thing on the other side. And also, when we do treatment, it's also a way for us to determine what's going on with the body as well, because it's insight into their pain points and their limitations. So if you guys notice that one side is higher than another, and it happens to be that higher side tends to be it's actually on the pain they're having, or the side they have pain on, most likely that is playing a factor into why you're having pain. Okay? So the body doesn't like have two equally bad ankles, and one that's normal and one that's not, and that's how important symmetry is throughout the body. Okay? So next thing you guys can do, the next one is called the couch stretch. Okay, I'm going to be using a chair. Okay, you can use it just as long as you have this back foot elevated. That's all that matters. You can use the couch. You can really actually use that wall behind it as well. And we just need to be able to elevate this back leg. Okay, so you're going to put your foot here, and then you're going to kneel down. Okay, we're going to do the same thing. We're squeezing our right glute, pulling our rib cage down. We should feel a stretch a little bit lower. Okay, now we have a knee bend. It's going to put that quad on stretch a little bit more. Now we're not going to be hitting this hip flexor as much. We're hitting that quad. Okay, so this is, for people that come in and have knee pain, this is our go-to, one of the first exercises we do. People, so you can get a lot of pain relief pretty quickly. And again, all stretch is not just like the ones I'm showing you today, it's all be held for 30 seconds. That's what the research shows. Almost respond best to 3 sets of 30 seconds. And you can also do the same thing on the other side. And again, if you have pain in the knee with kneeling down, just make sure you put a pillow or something or a pad there. Okay? Alright, so the best way to loosen up the muscle is a combination of foam rolling as well as stretching. So if you guys have a foam roller, if you don't, then you can use the cast, like you can freeze like a water bottle or something like that. Alright, what you're going to do, you're going to roll out that quad. Okay, but I see a lot of people foam roll the quad incorrectly. Okay, quad stands for that quad muscle is a very large muscle. It's not, it doesn't, everybody thinks that the quad's just like right here. That quad actually goes all the way from here on over. Okay, so we need to get the lateral quad, we need to get the inner quad. Okay, most people just get 1 or 2 parts of that quadriceps. Okay, so I see a lot of people that foam roll, okay, with the toes going straight down. We also want to rotate your toes out and get a good, build some good mobility on the inner quad as well. Okay, and then we also can put your toes in and get the outer part, so the lateral part of the quad. Okay, if you want to make it more tense, you kind of go on one leg, and roll out like this. Okay, a lot of people also go way too fast for this as well. You want to be going nice and slow. You don't want to be doing more than about a minute or 2 on that quad. A lot of people over-foam roll too. Okay? So one way you can make this more intense is actually crossing one leg over the other and rolling back and forth like this. Okay, that's too intense. You can just do 2 legs at once. One thing you guys can do too, if you can find a real tender spot, okay, we can do is you can pause. So like right now I'm going to have a knot on my left quad. What I'm going to do is I'm going to pause on that. What I'm going to do is I'm going to bend my knee nice and slow, and then we're going to straighten it back out. And I do like 10 repetitions of this. Okay, and what this is doing is when we pause on that knot, we're hitting that knot against the top of that foam roller. And as we bend our knee and straighten it, it's pulling that quad over the top of that foam roller as we lengthen and shorten it. Okay, helping to release that knot or that pain point as well. Okay. One thing you guys can do too is release the knee by laying on your side here. Okay, putting the foam roller on the inner part of your leg, and then what you can do is you can bend your knee and then straighten it out. Bend and straighten out. Okay. And that can just help loosen up the inner part of that leg as well. Okay. All right. Any questions from those guys? I'm going to go over some exercises you guys can do before you run as well that are great for warming up. In my opinion, the best exercise before running. And it's also a great way to strengthen up the glutes as well as the feet. We didn't talk much about feet, but that can also play a factor into knee pain as well. So if you guys have, if somebody has like flatter feet or has poor foot control, watch what happens to my knee as I clasp my foot in. Okay, you guys see how when my foot claps in, my knee's gonna follow. Okay, so that can cause knee pain as well. So a lot of times, really rarely is the knee actually responsible for its pain that's experiencing. It's usually what's happening above and below that joint. What's happening at the foot, what's happening at the hip, how's help in hip control. All right, we talked about how important how important hip strength is. Okay, we just talked about hip, or how much foot strength is, how important that is. So what we're gonna do is we're gonna do an exercise that's gonna help target both of those areas and help kind of wake those muscles up. So you can do, so you're gonna stand on one leg, okay, you're gonna bend the other, slightly bend this left leg, and then you're gonna keep this other leg bent, and then we are going to go out and back in. Out, back in. Okay, one thing you can do to make this more intense is actually put a band around the knees, okay, and then go here, back out, or back in, back out. And as we pull our leg out, if we have a band on around our knees, what that's going to do is we can try and pull this knee into this direction. Okay, that's the direction that we don't want to be landing with when we're running. So if we can fight that resistance during this exercise and really train that knee to not do that, that's going to help carry over into our running and decrease our risk for knee injuries as well. Okay, you can do like 15 reps of this. What this is doing is also improving our balance. You guys may feel like your foot's kind of working as well. Okay, out, and then you can do the same thing on the other side too. Okay, so that's a great exercise to do before running. You do like one set of 15. You don't want to be doing like 3 sets of 15 or anything like that because you don't want to be fatiguing those muscles out before you run. Okay? But to strengthen up that muscle, you can do like 3 sets of 15 on days that you don't run. Okay, to start building up that resiliency. Okay, that's really the most effective, in my opinion, the most effective and efficient way to wake up those muscles that are super important for running. Because we're never, to warm up for running, we should be doing like single leg exercises. Another great thing to do is like lunges, okay, walking lunges or static lunges as well. Because they're all single legs, like that exercise I just gave you guys, that's also a single leg exercise. Okay, because with running, we're never on 2 legs. So we don't want to be doing a whole lot of double leg exercise. We want to be challenging the body in a single leg position. Okay? All right. All right, guys. Any questions or anything before we wrap up? Okay, hopefully all that made sense. All right, but for those that are having knee pain or hip pain or ankle pain with running, I want you guys to know that this isn't like something that you have to deal with. This isn't, a lot of times we hear so many of our patients that come in and like, yeah, I've been to a handful of physical therapists, been to a handful of chiropractors and see my physician, and nobody really is able to help me, and they're just like, oh, well, if it hurts to run, just don't run. Like that's no way to live, right? There is a solution. Right? We've helped hundreds of people be able to find that solution. So if you guys want help with that, let me know. You guys get 50% off for initial evaluation. If you guys schedule within the next 24 hours, we can also hop on a phone call. Before we schedule anyway, we always do a 15-minute phone call conversation or consultation to make sure you know that you guys are a good fit, right? And that we can actually help you. We're not here to waste your time. If we don't know that we can help you over the phone, then we're not going to schedule you, and we're going to find somebody that can help you. Okay. A lot of times, and sometimes too, like what's going on might not even warrant having to come in for a formal evaluation. Might be a super easy fix, and what we do is just hop on the phone call, give you guys a few exercises, and give that a try. And as long as those help, then we're good. But if those don't seem to help, then come in for an evaluation, because it just means your body needs a little bit more attention. I need to figure out what is actually going on, whatnot too. All right, happy to do that for you guys. And then, but yeah, if you guys have any other questions that come up, you can go in the comments and just tag me, or you guys can private message me on Facebook as well, and I'm happy to answer any questions that you guys have too. All right, but hope you guys found it beneficial, and then we will probably do another one of these. I think I'll have to look back at the poll, but I think the other one might have been, other topic might have been low back pain. So we'll be doing another workshop here in the coming weeks, and I'll be making sure to post that in the group on what topic we decide to do. Or if you guys have any specific topics you guys want to touch on, just message me and I can tailor it to you guys as well. All right. But yeah, hope you guys enjoy the rest of your Monday and have a good start to your week. And then I'll see you guys soon. All right, bye guys.